Suite with Dr. Vanita Zahn.
March is Colorectal Cancer Awareness Month, and the Colorectal Cancer Alliance estimates 149,500 Americans will be diagnosed this year. So the key, of course, is awareness, prevention, and early detection. And keep in mind, this is no longer just a disease of older people. Dr. Jill Genua with Capital District Colorectal Surgery Associates is here to school us. Thank you, doctor.
Thanks so much for having me. So
it had been for the longest time 50 and over, be screened, have a colonoscopy. That age has dropped, hasn't it?
It has. Actually, in 2017, there was an important paper that was published which demonstrated what many of us had suspected for many years. And that is that since the 1990s, the rate of colon cancer has been rising in patients younger than the age of 50. And these are also patients without the traditional risk factors that we would typically be on high alert for. And so we had been noticing this in our practice, and the American Cancer Society actually confirmed this with data in 2017. And since then, we've been on high alert in this younger population, and the American Cancer Society was the first to recommend that we lower the age of screening. And over the past year, many societies and task forces have also suggested the same thing, that we begin screening at the age of 45.
Dr. Genua, there was a battle to get insurance companies to cover the screening at age 50. Have they signed on? Are they covering it now for 45 and up?
It seems that there is overwhelming data coming out, and we really have not had much problem with it, especially with the newer data that's come out since 2017. It's really quite compelling. And when you look at the graphs, it appears very clearly that in the 1990s, this risk has been increasing, and it's continuing to increase.
Smoking, consumption, excessive consumption of red meat, alcohol consumption, all things that have been implicated in colorectal cancer. So how much lifestyle changing do we have to do? And I'm probably going to ask you a 2-for-1. Is the rise in obesity linked to the increase in colorectal cancer?
Of course. The big question is why? Why is this happening? Why are we seeing this increase in younger people? And keep in mind, this increase has been occurring as we've seen great success in screening and preventing and treating cancers in people over the age of 55. So in that population, we've done great things. So why in the younger population are things different and are things changing? And of course, we all want to answer that question. At this point, we have no single answer or explanation. Obesity has been linked as a factor, and certainly the obesity epidemic parallels a lot of these increases that we've seen in colorectal cancer, particularly in young people. But there's probably something more. A sedentary lifestyle, not just obesity, but lack of activity in your lifestyle has also been a contributing factor. We've looked at genes. This is being studied. Is this something that's inherited, that it's something being passed on from one generation to another? And the answer is not there either. There are some proportions that can be related to genes and inheritance, but most likely there is some sort of interaction between our genes and our bodies and the environment that's contributing to this increase.
It's so difficult because everybody wants that magic wand to be able to understand. And by the time you have symptoms, you're already in trouble, and those symptoms generally blood in the stool.
Not necessarily. Unfortunately, yes, sometimes there are no symptoms, and that's where screening is so important, and following guidelines and the recommendations of your physicians is so important, because often there are no symptoms in the early stages.
Yeah.
Symptoms that should not be ignored include many things that can also be attributed to other medical conditions, which is what makes it difficult. So generally, I like to tell people, don't avoid any symptoms. You're the best judge of your body. If something feels different, if you're seeing any bleeding, if you're experiencing any discomfort or change in your bowel movements, these are things that shouldn't be ignored under any circumstance, but certainly with respect to screening and prevention of colorectal cancer.
Dr. Jill Genua, colorectal cancer surgeon, specialist, thank you so very much for being with us. Hopefully, you know, you save one life and boy, you save the world. Isn't that how the saying goes? Thank you for joining us. And if you want more info on colorectal cancer, check out the links section at WNYT.com. Till next time.